Somehow I got assigned 2 slides on fertility preservation. I'm not an expert. In trans girls or assigned males, sperm cryopreservation is relatively straightforward. The idea is abhorrent to many of those kids, but the idea is also reasonable to some kids. It's not super expensive. It's not free. And some kids do choose to do that. The other methods I don't really know anything else about, and I don't think that they're very commonly used, and they cost a lot of money. The options for assigned females are fewer when you're talking about kids. You can put ovaries in the freezer. You can do other sorts of fancy things. It's very, very expensive. It requires a surgical intervention, and it's just not really practically done in most places that, to my knowledge, in youth at this point. SOC8 has now come out, and it just talks about the age for treatment. So previously, I think it said something like the age of 16 is considered the age of majority in many countries. Use this as a guide. That's SOC7. SOC8 says, think about treating kids at age 14 with hormones, unless there are significant reasons not to do that or to do it earlier. Honestly, 13 and a half, 14 is where I think many places feel comfortable to do that. I think you have to think about your community care. I think you have to think about being sued, think about all the other things that you think about. That does not mean that every 14-year-old is ready. That does not mean that every 14-year-old gets treatment just because they're 14. It means that that is an age where most experts feel comfortable that many children have the capacity to consent, assent for treatment, and often parents are happy with that. 14 is well beyond where an assigned female would be in puberty, and it's late for an assigned male, but it's still pretty early.